Welcome back and thanks for staying with us. Now, as the country grapples with the spread of coronavirus, Higher Health is seeking to reduce the incidence of health conditions that may occur during tertiary studies. They're proposing ways of using youth as a change agent. Let's discuss their role. We're joined by the agency's CEO, Dr. Ramneek Ahluwalia. Doc, good evening to you and thank you so much for joining us. Speak to us a bit about Higher Health. What exactly do you do and what is your mandate, especially considering the fact that institutions have actually closed their doors?
In fact, we've got about 2 million young South Africans, which are educated South Africans across our universities and across our TVET colleges in the country. And what we do actually is we ensure as much as there's a huge financial support given to our young people around education and producing the skill setup. We also need the whole wraparound issues, epidemics like HIV, epidemics like GBV, mental health, TB, STIs, drugs and alcohol, disabled population, students with LGBTQI. The aim is to provide them holistic support, not just financial, but everything in order for them to have graduate competencies, throughputs, and in order for them to be able to go back into the labor market, produce an economy. So our job is basically the hope of a mother who relies on her child to come out with these skills and eventually earn a living for the family and for the whole generation that follows from here. So a plumber, electrician, miner, and a TVET college from agricultural industry, fishery industry, automobile industry, right to doctors, scientists, journalism, engineers, everything comes from a post-school education system. And our job is to ensure that we give that skill set back in order for us to have these young people be able to take our economy forward.
And what are your efforts in fighting COVID-19 in the country, and how are you using young people to be those agents, to send through those messages?
We've got a massive army of about 5,000 peer educators that we develop every year through our second curriculum program. We are trained on HIV, they're trained on gender-based violence, they're trained on mental health. Parallelly, we've got about 500 academics that day and night work with us on ensuring that we are able to produce and fight these epidemics among the young people. Now, we've got these educated South Africans. We, through the networks, through our curriculum programs, we can reach about 2 million South Africans very quickly. We can galvanize them. Our aim is to develop them as change agents. Just yesterday, with National Institute of Communicable Diseases, which is NICD, we already started the process of live webinars. Our industrial revolution, our technology allows us to educate and train them and capacitate them. We've already developed a curriculum on coronavirus. We are now capacitating our academics and our student community, who can then be able to penetrate through our structures to across these educated South Africans. The aim is to reach these South Africans, young South Africans in our institutions, is so that when they're isolated, even if they are at home, they are with their families, with their peers, with their other children and communities, and they can put authentic information. We might not have the treatment for now with this virus, but what we have is the prevention tool, and education is prevention. And that's what higher education must do, and that's exactly what post-school education will be doing, trying to educate with authentic, absolutely updated information. As this virus moves, this virus changes its colors every second day. More global data comes. We update our guidelines on every second day. And as soon as we update, we have new information coming. And we want, through our education streams, to be able to educate our communities as early as possible. Inform them and make sure that they reach out their peers in such a way that our whole community, our whole country understands. If not all 55 million, our 2 million South Africans can reach as far as possible to our communities, to their families. And that's exactly what we want to achieve.
And speak to us then about how they can reach those people, especially in a situation like a lockdown. I mean, one of the concerns that have been raised with so much information going on, online and through technology is that, the poorest of the poor are not able to access that information. So how are you making sure that through, your initiatives, you're reaching out to those people? So
we're working on a series of campaigns. We've got, first of all, 22 radio stations, which are own campus radios and our community radios that reaches young people. So the first aim is we are working in training our radio journalists. We've got about 222 radio journalists that produce content on daily basis and that reaches out to our young students on daily basis. So the first aim is immediately we are reaching, we already started yesterday through series of webinars. We're going to capacitate our radio journalists and develop content. We've got an SMS campaign. We are reaching out to our young students from next week onwards, quickly around updated information via SMS, so that we can at least inform them, we can talk to them, we can reach out to them. Through webinars, we are trying to reach out with our telecommunication companies around data-free webinars, around OBS, which are systems and softwares which we can use to reach out to our students through quickly, through our academics and through our institutions, in order for us to capacitate them on coronavirus. At least with academics, we are very clear. With our support staff, we're very fast because the technology allows us to reach them quite quickly, and similarly with our senior management.
Sure.
We are preparing for any reasons. Our institutions are open, and we still have to live with this virus one day. How are we prepared? Our institutions are prepared. How do we explain quarantine? What is self-isolation? So we are also now preparing a complete guidelines, protocols and algorithms that we are consulting every element into the institution so that we can have a clear understanding of how we can, if we have to operate and ensure that we disseminate our education, how does the system still work? And that is exactly where it's going to go. So other parts of communication campaign goes around social media, mass media, using media houses like yourself who are helping reaching out our parents, our guardians, our students through your channels to educate and communicate authentic and more updated information regularly. And I think every stream that everybody has is exactly what we need to use and educate, educate, and educate. And education is prevention.
Absolutely. Dr. Ramneek, before we let you go, are you happy with how institutions of higher learning have reacted to the fight against COVID-19?
Well, still early days, but I must be very honest. Absolutely, the President's call on solidarity has been a call. We all have to play our role. Higher education's biggest role is education and producing the next economy in this country. Our role has to be able to guide, produce guidelines, produce systems, do surveillance, the researchers, and partner all the institutions around. And I think I've seen that from our institutions of higher learning. I'm extremely proud of them. I want the momentum to continue. As I keep repeating, we have a role to play. We have to educate our communities. Our communities are uneducated South Africans, and the only way we can fight this pandemic or this outbreak is to reach out to our communities, reach out to our young people. And if our students can, best. In fact, Sushma, the young people might not have a severe infection, but they are equally susceptible to this infection. And they are the carriers that can take it to an elderly or an immunocompromised. So responsible youth in this country is very important, even if we have to fight coronavirus. Coronavirus epidemic will depend a lot on our responsibility from our youth, because they might be a very big carrier to the most vulnerable. And I think we need to reach out to our youth, very importantly, to be responsible and to be able to understand this virus and be able to follow prevention so that our communities are safe and people who are extremely vulnerable are absolutely safe at this moment.
Well, thank you for that, Dr. Ramneek Ahluwalia, the CEO of Higher Health.